All right. Well, good afternoon, everybody. It is the 23rd of June, 2020. Just a little disclaimer. I have had my eyes dilated, so this is why I have sunglasses on and why Cynthia Edwards, the PIO, is over there, because she has to read the questions for me because I can't read anything. I literally can't tell you what it says this close to my face. So that's where we're at. Brian is on the Zoom, our epidemiologist. We've got Barb Young, as always, as our American Sign Language translator. If you're new to the program, you can always email questions to covid19.questions@chw.coos.or.us, as well as those of you playing the home game. You can ask us questions via the YouTube live feed. Now, ideally, our IT guy won't be in the entire time messing with the computer, but this is just how it rolls. So we'll get started. Brian, do you have anything prolific you'd like to say before we get started, or?
Wear your mask when you're out in public, please and thank you.
Please and thank you. I do think that brings up a good point, though. I'm disconnecting this thing since there are places that are now mandated for the reopening of their counties to wear masks, right? Everybody is supposed to wear a mask. So when you say wear a mask, please and thank you, like what is the importance of if we had to stress to someone that did not understand why wearing a mask is important? Why would you like them to wear a mask, please and thank you?
Yes, as time has gone on, we've seen, a pretty serious increase in the proportion of cases that are either individuals with very, mild symptoms, or even individuals that we would classify as asymptomatic that are testing positive for COVID-19, and therefore, even if you feel well, even if you, feel great, and you question whether or not you could possibly have COVID-19, there certainly is that possibility. Even if you become symptomatic eventually, we're currently working with a period of 2 days before you became symptomatic, as far as when you could have been infectious. So we are asking for everybody's help when you're out in public to wear a mask, and that just limits the amount of, severely limits the risk that someone that is walking around unknowingly a carrier of COVID-19 could be transmitting to other people.
Perfect. There's a very good reason to wear a mask. I wear one. I have my mask here with me. I have one in the other vehicle. My wife has a basket of masks but next to our door in the event that we are running out the door and need a mask. I actually have another one in the pocket of my jacket just in case I forget this one, because I'm prone to forgetting things. Okay, let's see. Nothing in the live chat yet.
Okay.
Ready for questions?
Cynthia's got a question. Brian, are you ready?
Yes.
It's a question from Anita. She says, I'm very interested in getting tested for COVID. However, my residence is technically in California. Is it possible for me to get tested? And if so, where? Do I need to be showing symptoms?
Good question. So with our current testing guidance that we have from the Oregon Health Authority, who mostly gets its guidance from the CDC, We haven't quite completely opened it up for anybody that wants one. But speak to your provider. You know, they know your own personal medical history. And yes, there are certain groups of individuals that have been demonstrated to have a disproportionate negative impact from getting COVID-19, that have, you know, the guidance says, yes, if there's somebody, even if they're not showing symptoms, they could potentially be an appropriate person to be tested. But ultimately, it is up to the provider that you're getting assistance from. So whether that is your PCP, your primary care provider, or someone, say at, you know, locally at the respiratory clinic and that North Bend puts on, you know, those are your options here to follow up and try to get tested.
And if Anita says that her home of residence is in California, if she's here, she must not be here like for long term. And I guess, as you said, Brian, with the respiratory clinic, you can always call 541-266-1650. And I think option 1 is to get to the respiratory clinic and ask the questions if you do have them.
Absolutely.
Tina would like to know, how risky are group fitness classes with social distancing, but without masks?
Exactly.
I would definitely consider that pretty risky. When we talk about 6 feet and under, that is really kind of under the idea that you are stationary. In other words, you're not just walking past someone, for example, very briefly. But you know, the idea is most of the time, if you have close contact with someone, you are usually stationary, I guess, or walking together somewhere or something like that. There are a few activities that greatly increase your respiratory fluid ejection range. And that is certainly exercising. That's one of the reasons why gyms were one of the first areas of concern, you know, back in March, when we were putting together, or the various health agencies were putting together, you know, places that needed to be, you know, a pretty serious concern for transmission. So, you know, you're talking about singing, you were talking about running, anything that's really kind of increasing your heart rate, and therefore then turning around and increasing your breathing, is going to expel respiratory fluid a lot farther than just potentially 6 feet.
Yeah, so odds are pretty, you know, I mean, if you're not wearing a mask, then definitely nothing. Could be a lot of that just flowing around depending on the type of class, right?
Mm-hmm. Yes, it's quite stunning, and that's likely, again, you know, most folks are probably aware by now via news that one of the largest outbreaks the state has experienced was at a church in Union County. And of course, at church, everybody likes to sing. And that's just one example of, you know, over 200 cases in one church. Rough stuff.
Well, I think you realize, you know, when you're talking about, you know, expelling these, you know, this virus, you know, or in the things that you don't really consider, like, well, I didn't cough on anybody. Well, but yeah, but if you have heavy breathing or the singing aspect of things, I don't think you really put 2 and 2 together in some of those situations.
For sure.
Being a healthy but over 65-year-old individual, I am frustrated by the trend of what seems to be a vast number of people who are not taking the pandemic seriously. I'm also very frustrated with some of the local information. For instance, I've heard more than one person say that the case from the hospital was a false positive, but I believe that Coos Health and Wellness stated that it was not a false positive. Can you clarify what the difference is?
I definitely understand this question, and I do agree that it is concerning in terms of the number of people that are just going about in public, and in some places not seeming to be too concerned, not necessarily maintaining social distance, not wearing a mask. That is absolutely a concern. I agree. That is the kind of thing that could certainly put a hold or even back us up steps if we were to start having a significant number of cases, as far as our county's status in reopening. So I am also very concerned about that. In regards to the false positive issue, bottom line, we don't feel that it was a false positive. There's still not any significant amount of formal analysis that demonstrates a concern about false positives. Not to be confused with a tremendous amount of information out there about various testing platforms and false negatives. So important to, I guess, make sure that everybody understands. So false negative is somebody that is truly infected, but would test negative, and a false positive would be, someone that is actually not sick, but is tested for whatever reason, and the test result is positive. So for that latter category, false positive, we're not certainly looking at any case as a false positive. If they test positive, we believe they are positive, and we're going forward with that. What has been a little bit confusing, I think, for some folks is, in an effort to try to explain the appropriate level of risk at a medical facility. I know there was a press release that kind of described essentially some seemingly conflicting information that certainly made some providers kind of raise their eyebrows at how someone could have been a positive based on the way they presented. And that's understandable to kind of scratch your head sometimes in situations like that. But as we've seen, there have been people with no symptoms that have tested positive. There have been people with very mild symptoms that have tested positive. So at the end of the day, I think there's an understanding now throughout the community that we're certainly never going to be, unless some new data comes out, we're never going to be confident that there is somebody that tests positive that we can say without a doubt, oh no, they probably don't have COVID-19. And so therefore, that's kind of the approach that we're taking. We're no matter how mild or lack of symptoms someone may have, we're treating it as if it's a positive result and a true positive.
We have a couple questions here on the feed. Kathy's wondering, is there a location for testing for antibodies?
There's a couple now.
Yeah, so it's been, I think, a couple of months now that Coquille Valley Hospital has been offering antibody testing. There are a few other organizations now that have been offering antibody testing, but the Coquille Valley Hospital offer was, I think, extended to anybody that wanted to run a test. And I do know that there are some other places that are offering antibody testing in certain situations, but I'm not 100% clear what that criteria is. I know public health, the CDC and the Oregon Health Authority has, from a public health standpoint, at least with the data that's available right now, we are not recommending that antibody testing be used as confirmatory or used for elimination practice in terms of when a doctor is treating a patient. It really just means that in some likelihood, you may have been exposed to COVID-19. It doesn't necessarily mean you were infected with COVID-19. And at this stage, there's still plenty of reason to believe that if you, especially as you're older, just because you've been around a little bit more, there's a pretty good chance that if you test positive, it may be because you were exposed to a different coronavirus, one of the older ones, and likely more mild versions. And in other words, if you've had a whole bunch of different colds by the time you're 60 years old, there's a pretty good chance one of them was coronavirus, and that could be what actually is making you test positive for a COVID-19 antibody test.
I believe also I just saw an email today saying that they have it at Southern Cruise as well in Bandon.
Cool.
So that's good. A couple more here on our feed. What about Wednesday market in Coos Bay? Even though, even if you wear a mask, isn't there a concern of exchanging cash? And how can we support the local farmers while maintaining social distancing?
That's an interesting one, because there's a lot of places that I've been that won't take cash, that you have to pay by card.
Mhm.
Right. I have noticed that too. There's a lot of different vendors that only take cards now. Hopefully they'll be using appropriate measures, especially if they can take cards. Also potentially, using really good disinfection protocol when they are, exchanging items. That's kind of a tough one. Where if something's outdoor, we already kind of feel quite a bit better about that, with all other things being equal, than something that's indoors. So that has that going for it. But yes, anything that you could potentially touch has a chance of having been touched by somebody else that was infectious. So we're certainly urging caution, and for booth vendors to do as much as they can to try to disinfect all the high touch surfaces frequently.
Okay. Otis would like to know, if the public doesn't know who or where a person with that has been tested positive for COVID-19 lives, how can we possibly know if we've had contact with that person?
I'm going to assume this question is coming from the point of how do we do contact tracing if the people aren't aware of who they've had contact. So when someone tests positive and we're working with a case, we are asking them to let us know who all they have had contact with. And we do contact tracing from there. And then the individuals that we contact from there, we don't necessarily provide really any information about the context. And we just say, hey, we've been informed that it's pretty likely you may have been exposed to COVID-19. And then we essentially just kind of default treat them as if they could potentially be coming down with COVID-19 soon, or already, depending on how long it takes for us to put information together and reach someone based on how quickly everyone cooperates. As far as, how do you protect yourself if you don't know? Quite simply, we can use healthcare as a really good example. A lot of the precautions that are taken in the healthcare organizations are essentially treat people as if they are infectious. So that's one of the reasons why, no matter whether you know someone is ill or not, whether they could have COVID-19 or not, if you act as if they do and are potentially infectious, then that is the best way to protect yourself.
I know we've had some questions in the past, Brian, about sometimes how you gather information as to where people have had contact with others. And you've shared some of that. I thought that might be interesting for the audience to know.
Well, and I know that there's been a lot of questions regarding like, tell us what the zip code is, or and
Yeah.
the state has some of that tracking, you know, but we're not going to at any point share information that would allow you to narrow down who the individual is. Not that necessarily knowing the individual is going to help you if you don't know who that individual is anyway. Like
Yeah.
if you knew that the person positive was Eric Gleason, say it was me, and said Eric Gleason's positive. If you don't know who I am, there's a good possibility you don't know if you ran into me anyway.
Right. And bottom line, individuals who are ill deserve to have their privacy respected. And again, if we just kind of go back to that idea that if we are treating everybody that we could come into contact with outside of our household as someone that could potentially have COVID-19, we don't need to know who the individuals are that have tested positive or where they live or anything like that. I believe everyone can understand why that would be awfully just a serious invasion of privacy based on how there has been some reaction to individuals that even were just worked at a place that had some cases, have been treated in the community. And so I hope everyone would understand that it's important to protect that privacy, and just think, what would you prefer if you had COVID-19? Would you want me blasting out your name and place of employment and your address to the entire public? I don't think you would.
Well, I think that going back to the point you made just a few minutes ago, like when you walk outside of your door, treat like anybody you run into is possibly infectious, right? But yet you can go to pick a store and maybe 10% of the people have masks on, right?
Right.
So we had this big issue, and I know we've talked about it before. We've mentioned it with the media. We've had discussions on this very show, you know, that it seems as though that once the phases started to be reached and we started to hit phase 1, we noticed well, it's over, we're good. And then phase 2, it's definitely over now, we're good. And we've seen a lot of relaxing in kind of, I think, as a whole, in our PPE and our just the seriousness of how we have taken the pandemic as a whole.
Yep. I mean, we've had, if we just subtract Shutter Creek from our total, we've had as many cases in the last 7 days as all of the cases before that.
Right, because as more people go out and about, right, more people travel, more people come here from other areas, more of us leave the area to go places. If we're not taking our precautions seriously, and we can't assume that others are going to care about our well-being, so we need to make sure we're taking care of ourselves, and in turn we'll take care of other people because we're all taking the same precautions. But as we move about the cabin, we have a tendency to make things worse in some cases.
Unfortunately, that is true.
It's unfortunate, but that's kind of where we're at right now.
Yeah.
Okay. Fred states, I'm confused about phase 2 guidelines. I see restaurants in other counties on the evening news doing all kinds of things to keep customers 6 feet apart. However, here in Coos Bay, I see restaurants and bars allowing groups to all sit together in very close proximity. I've also seen photos on social media of large groups at a restaurant with dozens of people gathered together. Please clarify for me, are restaurants and bars in Coos Bay supposed to be keeping customers 6 feet apart under phase 2?
This is kind of a little bit of a tricky question. basically the idea would be if your own household, the people that you're already exposed with on a regular basis, and you know, the group of you go to a restaurant, of course, it doesn't really do much good, nor does it make much sense to make sure that that group is socially distant from each other. However, yes, any group that are not household members should be socially distant at this point. Now, you know, I'm not sure of some of the numbers as far as what people have seen, but it would be, obviously it would it would push the limits of reality to say that anytime you saw a group of 15 people in a restaurant, that they
all live together.
likely they're likely not all part of the same household. So yes, that kind of situation would be a concern. However, if it's a group of 4 or 5 people, you know, even if they're, say, like all the same age, you know, we certainly would discourage that, and maybe probably not likely from the same household, but really this kind of guidance is really meant to just say, come on guys, let's all do what we can to limit the spread of COVID-19, and let's not, you know, have to turn in, you know, restaurant staff and such into enforcers of public health. They're doing everything they can. They've had a really rough time the last few months. Let's just help them out and be reasonable. But of course, if you feel like there is a concern at a table like that, you know, nothing stops you from, you know, asking for a manager and seeing what they say as far as what's happening, what's going on with that table over there that's got 12 people and they all look like they're 21 years old, or you know, something like that, likely not in the same household, and see where it goes.
Because restaurant guidance, I think one of the pieces of it was that if they could increase their footprint, right, as far as how many places they could have available for people to sit, but they had to make accommodations for barriers between things that are less than 6 feet, that the staff that would be interacting with the consumer is supposed to be masked. I think all of them are supposed to wear masks.
Right.
And that's not just in restaurants, but that's in a lot of consumer facing, like employers that have a lot of close contact with their consumer, that they're supposed to be wearing masks. So there's a lot of things that I think are supposed to be happening. But, and I think, Brian, you're right. If you feel uncomfortable, then you say something, or you don't, I guess, eat there. But it has been a slippery slope for a lot of people trying to get their feet back underneath them during this whole thing. And sometimes I think people just need to be reminded of the importance of those guidance. The guidance for those sectors was made for the safety of everybody, so that we can continue to move forward.
That just kind of goes right into our next question. Daniel says that, I'm not sure if it's a he or she, works at Ace Hardware. I'd like to know that if we as employees are still required to wear face masks in phase 2. So are the employees like at a general store?
I think it's based on the sector, but I want to say it, and I have to go back and look at this, Brian. But I want to say that if you have that close contact with the public, that you're supposed to be wearing one.
So yeah, I think some of the sectors that they've really focused on, as far as if you're interacting with customers, you need a mask. A lot of those type of sectors are generally not considered to be the type of service relationship where social distancing is feasible. Say someone, you know, cutting hair, you know, stuff like that. And in those situations, it's mandatory for those people to be wearing masks. You could argue that a general retail establishment certainly has, you know, the ability to, you know, answer your questions from 6 feet or greater. So yeah, I'm not 100%. OHA has kind of taken over most of the guidance questions for specific sectors,
Mhm.
but I don't believe. I know a lot of companies are, regardless of what the guidance is requiring their employees to wear a mask, but I'm not 100% sure that all retail stores are compelled to wear a mask unless they are in a county that where that is required across the board.
Well, I know in Ace they've got two out of their 4 checkouts have like the plexiglass, the ones that are used most.
Mhm.
So they're behind some kind of barrier between the customer and themselves.
Here we have a couple here online. Kathy's wondering, how can we safely use playgrounds? There are some youngsters really wanting to get out into the playground. What are precautions we can take?
See, that's a tough one, I think.
Yeah.
Because unless you're willing to, and this is just from like as a parent of 2 young kids, unless you're willing to go and disinfect that play area, you really don't know when the last time it was used, or if there's a group of kids already there when you get there. Like, that's such a, it could be problematic.
You know, and children that size probably not the greatest about keeping their mask on straight. Probably not too concerned about, you know, yelling and
Right.
having fun.
Mine uses her hand and then her pant leg as a tissue. So I would imagine that there's a real good possibility that she uses her hand and then the slide bar to do the same thing.
Right. I mean, I do believe that there is a strong reputation for small children being human petri dishes before COVID-19.
Yeah.
Yep. I think that's the dynamic that we're having a tough time with there.
Yeah, I know. As myself, I am not taking my kids to the park.
Yeah, I wouldn't either, honestly.
I got them chickens. They can chase chickens and stuff.
Okay, I have another one here from Barbara. She's wondering, when new cases are reported, why aren't we giving any background information on what places have been identified in contact tracing where public exposure could have occurred?
Well, I think it depends. I know that Brian and I've had this conversation a few times where if it's something that would be major, like say it was the Wednesday market, right? And you knew that you have no idea how many people are at the Wednesday market, that there would be a PSA that would go out ultimately saying, if you were here on this time at this day, then maybe you've been exposed, right?
And a lot of it also is just about the level of risk. If you say a store, just like this massive store, and you know somebody happened to have been there on a certain day, I mean there's so how many square feet of surfaces are there in that store, and it really just kind of becomes an issue of diminishing returns, where the benefit of explaining where something was and cause and all of the negativity that would come with that, does that really outweigh the risk, which compared to the risk of a very minute chance that someone could potentially have gotten sick in that scenario because they happen to have touched the same surface. It's just really not, it's just not helpful. It really just kind of becomes the whole weighing the risk and benefits, and it's just not very beneficial. It's gonna, on a given day, for example, how many people have went through, say, a Walmart or a Fred Meyer, or hundreds and hundreds and hundreds of people, and they're already disinfecting some of the highest touch surfaces, like on a regular basis, like door handles and checker areas and stuff like that. It's just not reasonable to believe that in those situations there would be a high level of risk. Now it depends, right? Like if we're talking about somebody that just happened to shop there one day and they were in the store for 5 or 10 minutes versus somebody that worked there, and if we find that they, for whatever reason, worked for days after their after their symptoms started against what we would normally like to have happen, then that could be a very significant exposure where a lot of people could potentially be infected, and so those kind of decisions would be made on a case-by-case basis. But the level of panic and all the other negativity that comes with naming a place versus the actual chance that someone is infected is what really has to be part of the conversation there about whether it's helpful.
What do you think the shelf life of the virus is on Lycra?
Lycra.
You're shopping for stretch pants.
That's not one of the surfaces that have been tested. I don't think. I'm not sure.
How long does it stay? On pleather shoes, like how long?
We could test them.
Right, there's some things we need to figure out first.
Yeah.
Dean would like to know, can you confirm or debunk the belief that this pandemic will not subside until at least 60% of the population has been infected? With so little testing, how would we even know?
Short answer is I cannot debunk nor confirm. We know this is an extremely infectious virus. It stands to reason that even if we were to freeze everybody and down to the point where there was just maybe a couple of people that were infected and then restarted everything back up, there would be a really good chance that it would spread, and it would spread quickly. And I think people do need to buckle in for the long haul and be responsible to make sure that there are a lot of states that have come out with some just massive case totals recently. Oregon, our own state has had most of its single day highs pretty much all in June. So, and everyone knows how much we really slowed things down for a while. And as soon as we started kind of opening things up a little bit, it came rushing back. So I think we need to buckle in for a long haul where we need everybody's help to be as safe as possible and responsible as possible.
Mm-hmm. Barbara's asking again, she's the one that was asking about new cases and reporting, how do we know if there's been a public exposure? And we were talking about a store. She goes, she's concerned, would it be different like in a restaurant or a recreational facility?
It could be different. Again, case by case basis, depending on the situation, it absolutely could be different. In some situations, for example, there are certain sectors that are essentially required to, keep name and contact information of the people that have come in, just in case there is the need to do contact tracing later. And so in those situations, no, it wouldn't be necessary for us to blast that out, publicly. We would have the ability to contact everybody that was in a particular building or a particular area, and handle that part of the investigation. So yeah, case by case basis. So far, there hasn't really been any situation where we either one felt that there was a high risk of exposure and an elongated exposure, or a situation where we couldn't find out who all had been exposed just based on the information that was available to us without needing to blast it out publicly.
I'm gonna ask. I think just to try to maybe give Barbara something here. If this is a hypothetical, obviously, and I'm not trying to put you on the spot, but
No.
so say we were at a restaurant, right?
Mhm.
We were at a local Greasy Spoon or something, and Cynthia and I are sitting at a booth having dinner. We're going to be there
Yep.
for maybe an hour, right?
Yep.
We're at a booth, and there is a booth right behind me, and I'm just sitting here, against the wall, feet up on the booth, arm over, chatting away, talking to her about something, and the people next to me, no barrier between us other than the back of the booth. And maybe I can see this person's head. Like that would be, we would be within 6 feet of each other for 15 minutes. And if I said I was sick, all something happened and you contact me, your team contacts me, and I say I was at X restaurant at this time, it would then be on me to tell you as a contact tracer, and there were people sitting within feet of me, but I don't know who they are.
Right.
And then that situation there might be warrant a little bit different approach, right?
Yeah. So there are actually quite a few tools that are available to us in a situation like that. Number one, I would immediately have a concern that there is somebody in the very next booth. That certainly is not. We would be asking that question because we're not going to default just assume that everybody's following the rules they're supposed to follow.
Sure.
So that would be an immediate red flag there. And we would definitely want to be getting a hold of the people in that next booth. I will underline the fact that we are certainly not going to be getting anyone in trouble for this, although we may have a brief conversation with restaurant operators as to say, hey, that doesn't sound like following the appropriate protocol. Can we cinch that up, please? But what we would do at that point is this is one of the tools that we have available to us, especially say in a restaurant, and we've used for a long time with foodborne illness, is basically say, all right, guys, give us everybody's credit card receipts, and then we go through the process of contacting financial institutions, getting names and numbers of people that belong to those cards, and kind of going from there. In most times, everyone is really cooperative in that situation. We only retrieve the information that we absolutely need in order to contact someone before anybody freaks out about getting credit card numbers or anything like that. But that is, there are tools at our disposal that we can use to get a hold of people, even if you don't know them, in order to avoid having to publicly do a, hey, have you seen this person kind of advertisement.
We have another question on the feed. Arnold saying, should eateries have client logs? And is there any chance contact tracing apps on phones could become mandatory, as we have heard about it in other countries?
I didn't quite, I caught definitely a whole bunch of the last part there, but first part again?
Should restaurants keep track of who's coming in, kind of like the barbershops do?
I speaking from a very biased point of view, I would love that they were, if they were to do that of their own accord, it would certainly make life a lot easier. And as a restaurateur or manager, it would actually save us the potential possibility of having to publicly say, hey, everybody that was at restaurant X on June 4th or whatever, we don't want to have to do that because it can cause a lot of negative side effects. So yes, it would be best if it would be great if something like that could happen. And of course, we don't have to access that information unless we need to, right? We're not asking the restaurants to daily send us their lists and put it in some kind of a database. It would just be available should a case pop that involved said restaurant. As far as the mandatory cell phone apps, that is definitely veering into some pretty serious legal, ethical,
yeah,
and
we're
I'm
not
not
we're
okay
not at
with
a
it.
place where like GPS
not okay with
tracking
it.
on your phone is not something that would even be in the cards. Like, and
Right. I mean, if as much as some people may scoff at this idea, public health is not for some kind of draconian everybody stay in their rooms, from here to eternity kind of thing. That's not something that's helpful. Yes, if that were to happen, obviously all disease transmission would stop, but there is a careful balance that needs to be used. We
isn't
feel like that balance has been there. I know some people disagree, but
public health isn't one of the divisions in 1984. Like,
no,
for those Orwellians out there.
no.
Okay, Mary wants to know, she said free testing was offered to the employees in the fishing industry in Charleston. Some of us were not able to take the test due to our schedules. Do you still offer the test to the employees of the fishing industry?
I do believe there was talk that was something that could be repeated. I certainly don't have any dates or times or firming up of anything. It is a situation where I mentioned earlier that there were certain groups of people where testing guidance currently said, hey, even if someone's asymptomatic and is interested in getting tested, these groups of people would be pretty good targets for that. And food processing and things like that is one of those. There have been several high profile food processing plant outbreaks. And of course, food supply is definitely something we don't need to be tinkered with too much because of a massive outbreak that shuts a plant down or something like that. So it's still worth contacting your provider. But yes, I do believe the person that helped organize that has said that they are looking to potentially repeat that.
Yeah, I know. Yeah, there's been conversation. I think it's a great idea.
Mm-hmm.
Yeah.
Astrid states, a TSA worker I know said golfers are flying into North Bend Airport now, and the flight schedule is to expand through the summer. A PGA tournament is scheduled for mid-August. Are these air travelers getting checked at their departing airport for preeminent COVID virus disease?
Well,
there are a couple of things wrong with that. It's not a PGA event per se. It's a
USGA.
US Golf Amateur Tournament. We have been in Bandon Dunes, the USGA. We've had a lot of back and forth conversations on making sure that they're going to be able to do that. If they are going to be able to do that, that all necessary precautions are going to be in place, and that includes testing. We're probably, some of those factors haven't completely been worked out, so we probably shouldn't go into too many details here, but suffice to say that they reach out to us and they have been extremely frank and forward about the fact that they want our feedback and they want to do things in a way that we're comfortable with. So yes, that is something that could potentially be happening. I wouldn't say now. It's as you mentioned, the tournaments in
August,
currently scheduled to be mid-August. But yes, there is going to be a significant testing protocol for that to go off.
Well, what was the
The question was,
what was the name of the person that asked the
oh,
question?
Astrid.
Astrid. Astrid, if you're listening, golf was never actually taken off of the activities that were acceptable, even in phase 0 of COVID-19, based on the social distancing aspect of the game itself. Provided that individuals could maintain 6 feet, they weren't congregating in groups in the clubhouses, that golf was still acceptable. Air travel was also never really stopped during the whole thing. People have been able to travel about the United States during this COVID pandemic. Bandon Dunes actually shut themselves down when everything started to go sideways, and only reopened the 11th of May, Brian? Yeah, it was May. 11th of May to regular guests. So I doubt, I mean, every state has different regulations for travel in and out of their state. I know Alaska, you have to have a negative COVID test or basically quarantine when you get there for 14 days. Oregon doesn't have stipulations like that. So people are allowed to fly into the area and go to Bandon Dunes and play golf. There's nothing stating that we can stop that from happening. And with the steps that I know that Bandon Dunes has taken, that we have personally seen and had tours of the facilities to ensure the safety of those that live in our county, as well as those that are coming to visit to play golf. Bandon Dunes has taken exceptional care to ensure the safety of everybody. The USGA, as far as the U.S. Amateur, the 120th U.S. Amateur that could take place in August, has taken extremely thorough steps in their protocols for what they want to do to ensure the safety of everybody involved. Public health and our team is involved very deeply with Bandon Dunes and the USGA while these conversations go on, and we will continue to do everything we can to ensure the safety of our community.
Okay, so to add on to that, Barbara was asking on the feed, are we aware what the protocols are at the at the airport in general? Do we know if they're testing while people come in and out, like, or at least doing like temperature and symptom checks?
I haven't had a conversation with the regional airport, so I can't answer that question. I can reach out to them and see what they're doing, though.
Okay. These next 2 questions are very similar. Both Sharon and Tina were questioning how we list our case count. They've noticed in other counties where they will sometimes report active cases or positive cases, how many people have died, how many people are in the hospital, and how many people have recovered. But they've noticed in Coos County, we just say positive cases and presumptive cases.
And negative cases. Yeah, there, so far we'll probably at some point going to be looking at recovered cases. Really what that's going to look like here pretty soon is just anybody that it's been 60 days since they tested positive or became a presumptive case. And then we're fortunate enough not to pass away. So I question the usefulness of some of those statistics, except for the hospitalization statistic. Up until today, there has been no hospitalized cases that we've had. Although there has been one that we recently learned about. So it's that's certainly something that can be added. the recovered cases, I think the biggest thing we were dealing with was there for a while, and still technically now, the vast majority of the cases that we had were from Shutter Creek. And the Department of Corrections was putting out their own information about cases that were recovered and using their own criteria as far as judging how that works, which they got a little bit from the CDC regarding those that are incarcerated. So our situation's been a little different kind of from the beginning, and active cases, I guess they would have to explain to me what that means exactly. I think for most people, they're trying to determine whether or not someone is still potentially infectious, or perhaps maybe just still under quarantine isolation request. But yeah, we'll certainly reevaluate information that we could potentially give out.
Okay. And then kind of right off of that, JW was asking, shouldn't we be separating out those cases from Shutters Creek? Weren't they not originated in Coos County? Wasn't that transferred in? And should they be not counted against us?
So first of all, while there was one case that was associated with Shutter Creek that we did believe that there was a pretty good chance it was, the person contracted it elsewhere before they were transferred into the facility. First of all, we don't 100% know that. Second of all the other infections that came from Shutter Creek were very likely occurred here. In terms of quote unquote counting against us, I will try one more time to try to clear up this myth. In terms of counting against us, what the criteria that's being used as far as, hey, are our cases kind of getting out of hand? Do we need to look at maybe taking a step back to phase 1 or something like that because of our cases? They're really just looking at the most recent trend. They're not going all the way back to February, for example. They're just really kind of looking at the last 28 days. Has there been a dramatic increase in the rate of infection? How are we doing in terms of tracking where someone became infected? There's a few issues there, but I think there's a misperception as far as what it means to say count against us. They're not looking at the total case count. As far as the last 28 days go, all of the Shutter Creek cases are off the table at that point. So they are absolutely not counting against us in any metric that is important. Communicable disease reporting has always used the county of residence in recent history as where a jurisdiction, which jurisdiction gets quote unquote credit for a case, and that's just for multiple reasons. That's always been the way it is, whether they leave the area afterwards or not.
That's it. Right?
Yeah, I think that pretty much wraps it up. I know, damn it, it's bright. I know that we had talked about knocking this back to just kind of once a month. I think that starting next month, second Tuesday, we'll just do second Tuesday of every month and go from there. We can always ramp it back up if things get out of hand and we need to have more of these. We can always put them back together. But I think we'll just drop down to second Tuesday of every month until we no longer need these, hopefully. So in a year or so, we'll be able to wrap this up. So thanks, everybody. Thank you for your questions. If you have questions that you think of throughout the next, I guess, 2 weeks, because we'll come back together for that second Tuesday, email us covid19.questions@chw.coos.or.us. Until then, everybody stay safe and take care of yourselves. All right.